On August 15th of 2002, my only child, Katie, with her 10-year-old cousin, Katie was 11 at the time, had gone on an excursion in Montana to go swimming. In the meantime, a severely out of control diabetic driver lost consciousness and caused an off-center passenger side head-on collision, and my 11-year-old child took the brunt of the crash, with 8 people involved, 1 fatal injury, my daughter. The next car on the scene had a licensed practical nurse who had expired emergency medical services training, and she felt for Katie's pulse, did not feel a pulse, became covered with Katie's blood, and then when the emergency medical technician did arrive about 10 minutes later, she told the woman, the EMT assigned to Katie, she's already gone. And unbelievably, the EMT turned around and walked away from Katie. When I talked with the EMT, again several years later, that particular EMT, she said that she just didn't know any better, and we have to do better. And when a child's life potentially could be revived, we have to do better. I will always be tormented by the possibility that had CPR been administered, had an automated external defibrillator been used with Katie, perhaps her heart could have been revived, and perhaps she could have had a chance. At least I would know that everything that could have been done for Katie had been done. Even with the same outcome, I would feel infinitely better knowing that something was done for my daughter. You have no idea of the devastation on top of the obliteration of my family that is created by having an awareness of nothing being done for your child when it should have been.
In 1999, the Emergency Medical Services for Children program created the Family Advisory Network to facilitate the inclusion of the family perspective into state EMSC activities. Today, the FAM membership includes family representatives from all 50 states, the District of Columbia, and 5 U.S. territories. Who are these representatives? What are they doing to help improve pediatric emergency care? Here are their stories.
Became involved with EMSC in about 1996 during the inception of FAN and the Family Advocacy Network. My first daughter, Amber Lee, was born with the nuchal cord around her neck and suffered an anoxic event at birth, and that subsequently has left her with very severe cerebral palsy. I also adopted a little boy at 14 months of age, who I had the privilege of enjoying for about 17 years until he was diagnosed with AML leukemia, and he subsequently passed away about 3 years ago.
I originally came involved with the Emergency Medical Service for Children when I was a state EMS director. I retired as state EMS director in 2004, and I was asked by the EMS for Children coordinator for the state to be a volunteer member of the Alaska EMS for Children Advisory Committee. Because my wife and I are raising a grandson, they decided to put me in the family representative slot.
I'm a mother of 4, and I am also a foster parent in Delaware for children with special medical needs. So that is why I was approached to join Emergency Medical Services for Children's Advisory Committee in Delaware.
I have actually been involved with this for 6 years now. My son, when he was 2, actually fell into our swimming pool. After 4 hours without a heartbeat, my son was revived. So you can imagine major atrophy in all 4 lobes of the brain. and for the last 23 years he's been a vegetative survivor of this accident.
I'm a parent of 2 children. I have a 17-year-old with autism that has had, unfortunately, experience with the emergency system in a variety of ways. And then I've also, we adopted a child through foster care that had prenatal drug and alcohol exposure, and through that experience I had a whole different experience with the EMSC.
11 years ago, I started with Virginia EMS for Children as the program coordinator. And then I was married and I was blessed with a beautiful little baby girl 3.5 years ago, and I transitioned to a stay-at-home mom, and I became the family representative for Virginia.
I oftentimes feel that I am kind of alone as a family rep, because when I come to these meetings, I look around to other family reps who have a really big reason that they are family reps. In other words, they have a child with special needs. And bless their hearts, I didn't experience that when I had all 3 of our sons. When I see some of these family reps and they share their stories with us, specifically like inter-hospital transfers or when they've actually activated 911, I hear those stories and I go, yeah, no wonder you're a family rep, because I mean this has affected you personally, and you understand that pain and that anguish, and you understand personally how to improve the system. And I selfishly kind of look to myself and go, well, the only part that I can help with is I'm a pre-hospital provider.
I got involved with the EMC program through Guam's EMS Commission. I was appointed by the governor to represent the law enforcement side. My primary job is a police officer with the Guam Police Department. My secondary job, which I am proud to tell everybody, is that I'm a mother of 5 children whose future is what I'm more concerned about.
I've been given many assignments, most recently a medical health information sheet for children with special health care needs and kids that have complex medical health needs. So we're enrolling children in our state at this point in the system in hopes that as EMS enters into the home, if there is a child with special health care needs, then they have up-to-date medical health information on that child that's housed in the refrigerator freezer in the home, as well as with the child in their backpack.
Everybody in New Mexico knows that I push PALS and push PEP and push pediatric education. So I think that's really where my particular family role has taken me, is the extra push.
My goal, and I believe that it will be shared by the EMSC program, is to have every able adult aware of the importance of CPR training and AED training, and vastly, dramatically improve the number of people who are trained, so that if someone comes on a crash scene, that person may be the one person who can save a life because of being trained and because of following Red Cross protocol.
I do have ongoing dialogue with our local congressman and House of Representatives, and I am forever touting EMSC to them in regards to children with complex healthcare needs. And I think it's even more important now in regards to children's medical health issues. I think more and more children are being saved, and parents are required to do many things in the home environment that they normally wouldn't have been asked to do, or that would have been done in a hospital environment. And so I think the collaboration between EMS, parents, and families is critical.
I think there's a lot of things in the EMS system that you maybe learned once and you can easily forget, and you need to be reminded from time to time. And the family reps can do that.
And they're in an amazing, powerful position, because your perspective is there in equally with other folks, you know, that are in, that do the work. And I think that and it's respected. I think that is what's really neat about this program, is that the family-centered care, the family perspective is really sought, acknowledged, valued, and used.
Find something that you're passionate for and that you can maybe make a change, or at least that you can just dive into. So at least it has some personal meaning rather than just some check boxes and some data collection.
Initially, as I came into the program, I was very overwhelmed. I didn't know all the people. I didn't know a lot of the acronyms and all the things that we're faced with in the medical profession, per se, even though I had been in an ICU. And it was a little bit of a challenge, I think, back then to network and meet people and to know where my place was.
I have been very fortunate to have a program manager in our state that has been a tremendous resource for me, as well as a personal friend through this whole experience. And if I could thank them enough, words would not be adequate.
All the tools that you would need to go through with your endeavors of getting the program across to your state or your territory is available. That the resources are endless, the resources are readily available, and if there are any questions, you can ask just about anybody and you get an answer right away.
An old-time family rep is happy to speak to a new one. Coordinators help each other. At every level, there's networking and sharing of resources and sharing of knowledge.
And the EMSC board for California is so supportive. When I said I would be willing to do this volunteer position if they would really back me on that campaign, and they were very much agreeable to that. They are 100% supportive, and we're doing a lot of great things in our state, and it wouldn't be possible without EMSC.
Absolutely, unequivocally, that EMSC has been a major changing partner in this whole healthcare paradigm. So I'm very much a proponent of EMSC and have been impacted greatly by the program.
The medical world really wants to hear and understand your experience and learn from it and use that to just improve capacity overall. I thank you all for doing that, because I think that brings a perspective, a lens, into how you serve the families that is not always there.
EMSC is a wonderful, wonderful program doing the best for children. I mean, what a system. Making sure that all these sick and injured children in a pre-hospital and hospital setting are taken care of. These children can't be their own advocates, and what a voice EMSC has. It's fabulous. I'm proud to be a part of it.